So, Bismillahirrahmanirrahim, we will talk about today's lecture. Now, two lectures are left about female reproductive system and male reproductive system. So, we will start with female reproductive system today. Now, first of all, what the reproduction is? Anybody who can tell me what is reproduction?
The process of bringing new kid to the life.
Yes, to create our children,
new gene,
new genes, to add to the generation. So for this reproduction in our body, we have some special organs. Now, one process of reproduction you have seen in chicken. For example, you know well, every day morning we have a breakfast with eggs. So eggs are the reproductive material. Now these eggs, when they are kept under special temperature, they produce chickens after few days, 21 days of special treatment. They do not need that the hen, the mother should be there. The eggs, they are placed in a special machine that we call incubator, and they can produce chickens, small chickens, chicks. Now these do not need mother, but in human beings and other animals, we need mother for our reproduction. So reproduction with the help of the father and with mother, the process is complete. We have got the special organs in our body which help in this process. So this is reproduction. Now again, if you see this diagram, because we will be talking of female reproductive system today in females, in mother's body. So we have a section of our body over here of a female body. Now, if this section has been taken from the center of our skull, there is one suture, sagittal, so we call it sagittal section. This shows half of the body. So let us go further. We have got these sagittal sections. So in sagittal sections, we always try to recognize what we can see in a picture. Most of you can recognize, for example, if we go over here, we have got, even here, we have got what we call vertebral column. And this part of the vertebral column is because vertebral column, it is a long column consisting of various bones.
And we show the disc.
We call it vertebrae. A singular is called vertebra. And when we add them, then we call it vertebrae. So we have got vertebral column made up of vertebrae. Now this portion, we name the vertebrae according to the region. For example, in the neck, we call them cervical vertebrae. Similarly, over here, we have a sacral vertebrae. But these sacral vertebrae, they join together to make one bone that we call sacrum. So this is a sacral part of the vertebra. In front of this portion of our lower part of our abdominal cavity, that we call as pelvic cavity. So pelvic cavity is the region, is the cavity where we have got reproductive organs. Now, if we try to recognize, so we have got recognition, we have recognized vertebral column, sacral bone, then last part, the coccyx bone. Then in front, we have got a joint. This is our abdominal wall of the abdomen, because it is a front, so we will call it anterior abdominal wall. Muscles are there. Then we have got a joint lower. We can feel this joint in our body, pubic symphysis between two hip bones. So this is the two limits from the vertebral column, and this is all process of the vertebrae which we can feel, spines. Then we have got muscle and skin over here, the region of our buttocks over here. Then we have got in front the anterior abdominal wall and pubic symphysis. So you recognize these things now. Then inside we have got, this is part of our abdominal cavity and this is part of our pelvic cavity, pelvic cavity. Now this cavity will have got will contain reproductive organs, plus last part of our gastrointestinal system. Last part of our gastrointestinal system, like rectum. Then if we try to recognize, and we started from before backward, yani from front to back. So we have got one organ over here, which we have, which is a part of our urinary system, urinary bladder. So from here, we, in this organ, in this bladder, we receive urine from two kidneys and it is thrown out through this portion that we call urethra. This is the opening of the urethra over here. So we have got urinary bladder and urethra. Urethra is the tube which will throw out urine from here to the outside. Then behind to this, if you look, this is female body. We have another organ that we call uterus. This is the cavity, this is the chamber where we all are placed to during our developmental period. So this is the site where we develop for the whole period of our development. Then we are born. So this part is uterus. We will see this uterus in some other pictures, different parts of the uterus. Then this uterus, it will lead into a space over here. It is suspended in a space that we call vagina. So this is the vaginal portion. So outside, if we look in a female body, outside we have got opening of the urethra and opening of the birth canal through this tube, vaginal tube. It is opening, vaginal opening. So we have two openings on the outside in a female body. One is for passing of the urine, urethral opening, and second is for passage, that is where passage of the child during birth, or we also call it what we call the opening of the vagina, vaginal opening. Now behind to this, the last part of our GIT system is placed, is coming. This is the part of the rectum. So if we want to label the structures from before backward, we see a joint here, pubic symphysis, urinary bladder, lower down urethra. We have got the vaginal canal. Then we have got the rectum. Now these are the various areas where fat is deposited. The material fat is deposited over here. So we have got these organs. So out of this, the first organ, this is urinary bladder, part of our urinary system. Sorry. Then we have got the part of our reproductive system, the uterus and vagina. Then we have part of our GIT system, rectum, and then the last opening, the anal opening, anus. So this is a sagittal section. Look at above. They have put forward from uterus, we have got and a tube passing out that we call fallopian tube or uterine tube, or some people we call it oviduct. So this is a tube. Then another organ is suspended over there, which we call ovary. Now, just to introduce this, these organs, we have said that in uterus we have developed. All of us, we have developed in mother's uterus. This ovary is placed. This is actually from the word ovary. The word ovum is equivalent to the egg, but we call it ovum. So this is the factory for the production of ova. Then from hair ova, they come and they are released and they pass through this tube and they can reach into the uterus. We will see some other sections to understand more. Again, in this diagram, if you look, we have got the pubic symphysis, urinary bladder, uterus, and rectum. Then we have got urethra, opening for the urinary bladder, the tube and opening. Then we have got the uterus, then vaginal, and then vaginal opening. Then we have got the rectum and anal opening. So this portion, base of our body, this is what we call perineum, this region. So here we have got three things in female body. We have got the urinary part, we have got the reproductive part, and we have got the GIT part. So this is these are the three openings in female body. Of course, in male body, this opening will not be there. So we will have urinary opening, urethra, and we will have the anal opening. So this is in a sagittal section how we recognize. Let us go further. In our reproductive system, another important organ is breast. In females, we have developed a breast on the front of our region that we call thorax. So we have got a strong muscle over here and then skin and fascia. So this in fascia, we have got development of breast. We will not study at present the structure of the breast, but just the function of the breast is to produce milk for the newborn, for the baby. So this breast, and second thing is we will study it in details, because if you remember, you might have studied that breast cancer is the commonest cancer in females. So we will study them detail. So in breast, what we have to remember, we will revise some terms for breast. For example, we will call this portion as the nipple. Then we have got areola. This is the nipple and this is the areola. This is the rest of the breast. So this breast is resting in our thoracic part. Two breasts, one right and left breast. Then we will go further. We are looking at the reproductive organs from front now. We have seen in our previous picture from the side. This is a sagittal section from one side. Now we have taken this whole out, and this uterus and vagina, and we have expanded and we are looking at it from front. Now you can look clearly that in this frontal view of our reproductive organs, we have got, if we start from below upwards, we have got this portion vagina, which was opening outside to the vaginal opening. Can we move? So this is the vagina. It will open outside through vaginal opening. Then this is all part which we call uterus. Then we have got from two sides of the uterus, this area, we have attachment of the uterine tubes or fallopian tubes or oviduct. Then we have suspension, two ovaries on the two sides. They are suspended mollek from the uterine wall like this with some ligaments. They are not connected with this, but they are just suspended. So this is ovary. Now this is complete ovary, and we have make a section of the ovary. So inside ovary, please look at this. We have got this blue things, the ovum. These ova are placed in the chambers in this compartment. So these compartments are called follicle, ovarian follicle, ovarian follicle. So we have got follicle, ovarian follicle, FOLL, LICLE, ovarian follicle. So these follicles are chamber. This is one chamber. This is the other chamber. They contain ova in the ovaries. So when the ova comes out of the ovary, we call it ovulation. So ovulation is the process when one ovum is produced from ovary out. So normally this ovum will come over here. Now, before we go further, we will see this fallopian tube. If you look at this end of the fallopian tube, this is like fingers. These are all, this is end of the tube, open end. So this arrangement, this shape, we call it fimbriated, finger-like. Now, in living person, in normal life, these are always moving, always moving. So when the ovum is released from the ovary, it will be attracted by these fimbriae. So it will enter. So this ovum will enter over here in the tube. Now it will travel, it will travel through the tube until it will reach here in the cavity of the uterus. Now we will talk about this further, but at this stage, please remember that now let us see the uterus. So we have seen we do not remember the parts of the tube. There are certain terms which we will revise again in our next discussion when we see the details of our report. But for uterus, we have to remember that this part of the uterus, look at this, they have marked out this portion. This we call cervix of the uterus, cervix. And this portion, look at this portion is suspended in the vagina. This portion is the body of the uterus, and this portion top is fundus of the uterus. This is the opening of the fallopian tube into the cavity of the uterus. This is cavity. This is cavity. So we have got fundus. If you write it here, F-U-N-D-U-S, fundus, body of the uterus, cervix of the uterus. Now look at the position. This part of the body is wide part, but this is narrow. This is cervical canal over here. Then it will open into the vagina. On the two sides of the vagina, we have got, if you look, this is one corner and this is other corner. These corners, we call them as fornix, F-O-R-N-I-X. This is singular. But when we talk of this, make it plural, it will become fornices. So fornix, N-I-X, fornix. So we have got fornix all around the cervical wall, suspended portion. So these are parts of the, now another name for this terminology we will see further, but at present, please just look for uterus. They have put these terms over here. One of the term is utero, about uterus. The other is hystero, matrio. For cervix, cervico. For the vagina, or for colpo. So these terms again we will revise and we will see them in further. So this is a front view. Just to summarize again, parts of this, we have got the fundus, we have got the body of the uterus, and we have got the cervix. This is the vaginal part. Then we have got fallopian tube, fimbriated end of the tube, and we have got ovary. In ovary, we have got the follicles, and these follicles, they contain ova. Let us go further. We will see details in next details when we talk of the biologists. Now, when we go further, we see it's different. This is again labeled portion. Now, all these parts, if you look over here, they have added something that these are parts which are actually sheets of peritoneum which have come down to support this this reproductive system. So these are what we call ligaments. Please mute your speakers. Please mute your speakers. How can we go further? Please
المايك
mute
يا
your
شباب،
speakers.
المايك نبي نسمع.
المايك
Mike, mute your speakers, please. So this is what we call supports of the by peritoneum. These are different ligaments which will keep the uterus in position. Then we can see some other glands attached with this. We do not need to remember at this stage, but these glands, they produce some secretions. They keep vagina wet all the time, mucus secretions. So this is another picture. Look at this fimbriated end. These are called finger-like process, fimbria. This is over here, we have got isthmus. Then we have got different part of the, so the ovum is traveling. So what we want to, from this picture, what we want to remember is that we are produced by two cells, all of us. We get one cell from our father, that is a cell which we call sperm. And we get one cell from our mother that we call ovum. It has come out of the ovary. So these two cells, they join together. Now, another thing at present, you can remember that all our cells, they have some fixed number of chromosomes. Anybody who can tell how many chromosomes we have in our cells?
I can tell you. In the normal cells in our body, we have two cells, but in
And
the
chromosomes.
reproductive system, yeah. But in reproductive
46.
system, we have one,
Ah,
just
pa-
one.
46 chromosomes.
are 23 pairs. 23 filjuda pairs. So all cells, they, what are these chromosomes? They carry all informations of our body. For example, color of the skin, color of the hair, color of the eye, length of the eye, length of the limbs, everything, all informations, they are written on these chromosomes. So we have got 23 pairs or 46 chromosomes. Now, when our cells, they mature to make a new cell, these chromosomes, this number of chromosomes is full number. We also called it diploid. Diploid number of chromosomes. Diploid. D-I-P-L-O-I-D. Diploid. Now, by division, they become half in these cells in sperm and ovum. They, from diploid, they become haploid. From diploid, they become haploid. H-A-P-L-O-I-D. So we get 23 chromosomes from our father in the cell that we call sperm. From our mother, we get ovum, which also contains 23 chromosomes. So when these two cells meet together, we have formation of new cell. So these two haploid cells, they make a new cell, and these two cells, they make what we call zygote. So these two cells, sperm and ovum, they meet and make a new cell that we call zygote. Z-Y-G-O-T-E. So this is a new cell. So 23, again they will make 46. Again, these two cells meet and make complete number of chromosomes. So half informations come from father, half information come from mother, zygote. Now this process, please listen, this process of meeting ovum with the sperm is what we call fertilization. We call it fertilization. So what is fertilization? It is the process of union of two cells, one from father, one from mother. These two cells, they join together to make a new cell, zygote, and this process is called fertilization. Fertilization. So we get from two cells, we get a single new cell. Now this cell will divide. This is single cell. All of us, we started from this cell, one cell. Then this divided into millions of cells, and we have got formation of our various cells, the group of the cells which were performing same function, tissues, then organs, then body. And this body is the organism. So we are whole made up different systems. Different systems are made up organs. Organs are made up of different tissues. Tissues are made up of cells. And cells, all cells come from this cell, from zygote. Please remember. So we have got this formation of this cell, and this cell is from father and mother. The process is called fertilization. Now these two cells, they are our reproductive cells. We also call them as sex cells. One from father in males and one from mother, ovum. The other name for these sex cells is gametes. Gametes from genesis, from production, for production. So we have a gamete for G-A-M-E-T-E, gamete for male gamete, sperm, and female gamete, sex cell, ovum. So joining both is fertilization. Now to summarize this process, how this is taking place, we have received in this part of our female body, received the male sex cells, the sperms. We receive in vagina sperms. Then from the ovary, one cell is released and this goes over here. This is the ovum. Ovulation takes place. This ovum will travel over here. Sperm will come from this side and they will meet here. Here. This is called fertilization. This is the site, location where fertilization takes place. Then a new cell will be formed, zygote, or a new baby is formed. And then this zygote will travel and will develop over here in the uterus for 9 months or 10 lunar months. So this is the story. Then we are born. Now this development which is taking place in our mother's uterus, this is what we call prenatal development. Pre means before and natal means birth. So this is prenatal development. So before birth, we start, please remember, all of us, we start one cell, zygote. Then this one cell divides into million of cells. And this is the development process. Then we are born. And when the child is born, again development takes place throughout the life. This is called postnatal development. So development, Gabalal Vilada, prenatal, Badal Vilada, postnatal development. We will talk again when we talk a subject of our development that we call embryology. So over here, what we want to remember, we have got a process of fertilization, process of development. Now what will happen? When the sperm is not available, then this cell ovum degenerates and it is dead. So this is the story, simple story that how we start our life. Then let us go to the next to our terminologies. Again, this we talk that we have a development. This is fertilized ovum. When it will travel from here, it will come over here. Sometimes it does not go to a normal place. It can come over here. It is a normal. But if it comes over here and it gets attached over here, this is not a right place. Right place is over here for development. It can go at wrong place. This is the right place. This is not the right place. So this position, we call it ectopic. Ectopic means not on the right side. So pregnancy occurring at this. So this is the picture which shows you site of this is normal site. This is the zygote coming from here. This was fertilized, then it traveled. It came over here and it attached over here in the uterine wall. Then we will develop as a child, then born out through the. So we also call this birth canal. If it is not normally it is over here, but if it goes here or even here or here or even outside here, this is not the normal site of implantation. So this we call ectopic pregnancy, ectopic, not on the proper site. So ectopic, not proper site. This child is developing the zygote was here. So look at this. This is what we call ahsan tahliq. From one cell, Allah has developed this beautiful child with millions of cells. So this is within the uterus. Now he or she is provided with these blood vessels which make umbilical cord, and we are attached with our system of our mother. We are not respirating. Mafit nafas. We do not take breathing, but we take oxygen through these vessels from mother. So we have a ready-made food, what we call manva salva. We are getting prepared food in our mother's uterus. So this is for the whole period of development. Then we are born through this tube, and then postnatal life starts. So this is for this. Let us see the terminology, the part which we are more concerned at this present lecture. So these are the terminology from the various terms which we will be using in female genital system. The first term is cervico. As we have seen already, this is concerned with the cervix of the part of the uterus. Cervix part of the uterus, and cervix part is this part of the uterus, this portion. So over here, anything related to this is cervical. Or if we put the word cervicitis, cervicitis, inflammation of the cervix. Then we have colpo. Colpo is concerned with vagina. So this portion of where the uterus is, the cervix is suspended. So this is the vaginal cavity. So over here, we use the word colpo or vagino. For example, colposcopy. You are aware of the scopy. Anybody who can tell what will be the meaning for this colposcopy?
Looking inside the.
Yes.
Looking
Look,
Examination.
one by one person at a time, please.
The visual
Colposcopy, look
examination.
into the vagina. Then look at the word vagina, vaginitis, inflammation. Hystero, we have talked about uterus. Look at the word hysterectomy, ectomy. We have been introduced.
Excision or
Yes.
new opening.
Cut.
Remove it.
Cut. Yes, to remove the part of remove the uterus. In cancer, for example, of the uterus, we have to remove the uterus. So this operation, this surgery is called hysterectomy. Hysterectomy. Now the other word, mammogram, for the breast. In common English also they called mama.
Record
So mammogram.
erased.
This is a picture of
Recorded
breast.
by X-ray.
Yeah. The other word for this breast is masto. Masto. So when we have when a lady has got
Excision
breast, we remove the breast.
or
This
removal.
is called we called mastectomy. Mastectomy. Now the cancer we have talked is the commonest cancer for the female. It's cancer of breast. So if we have one, for example, one cancer like this, one thing that we call a growth, a lump, a mass. So this lump, so what we have to do, if we take it early, check it early, we can remove this portion only. So we will call it lumpectomy. Lumpectomy. To remove this lump only. So breast will be spared. But if we diagnose this very late, then this cancer will spread to whole parts of the breast. So it will spread to all parts of the breast. Even it will spread to other parts of the body. So we have to remove whole chest, whole breast, not chest, whole breast. This is called mastectomy. Mastectomy. Then another word has come down, metrio. When we look into the uterus, this is the female uterus where we So we have talked that this part of the uterus is what we call cervix. And this is suspended in vagina over here. So this cervix, when we cut this portion, we find that it is inside, it is covered with epithelium. And this epithelium is lining. So this epithelium, we call it endometrium. Then we have got over here a layer of our muscles. This part, muscles, very strong muscles. This we called myometrium. Myo mean muscle. This is endometrium, inner lining of the uterus. Endometrium. Then outside we have connective tissue, perimetrium. So these are layers of the uterus. So we can use this term metrio for endometrium, lining of the about uterus, utero, for example, uterine vessels. Oo for ova, ovocyte. This is actually the ovum which is coming out from the ovary, the ovum with plural ova. So we used OO for this. For example, ovocyte. This is one cell, female sex cell or female gamete. Now this, please remember, we do not like to use egg for our human ovum, because when we call it egg, we always think of the breakfast egg. So we do not use it. It does not look decent. So we will be using term of ovum and ova. Then for ovary, we have ovophore, ovofrectomy. So on the sides,
Removal.
we have removal of our ovaries. So we have got uterine tube, and here we have got ovary. Ovarian cancer is also common in female. So we have to remove ovary. So this surgery is called ovofrectomy. Ectomy. So ovarian, concerned with ovary, for example, ovarian cancer. Then salpingio for tubes. We use another word. We have already we have called this tube uterine tube. Uterine tube. The other name for this was fallopian tube with FALLO, fallopian tube. Another name is salpingio. This is also fallopian tube. So salpingectomy, if we cut this tube, remove this tube, this is salpingectomy. So this is the basic terms which we will be using for our female genital system. Then we see further that what is over there in next slide. As we have seen the construction of our words, we have certain roots. So for female system, we have the roots. These roots are to be remembered. Now the roots are gyno or gyneco. So we have gynecology, gyne related to females, to women, and ecology, knowledge, logy, study of the diseases of women. Then we have got one word, meno or menstruation, menses. So we have the word Arabic had for this. So meaning is for month. So every month the lady after adulthood will get bleeding per vagina. So this is called menstruation. Actually, we have seen that the inner layer of the uterus, what we call endometrium, this goes away and blood will come out. So this is, in common English, we call them as periods. Only word period will denote menstrual period. So this is a cyclic change, a cycle. It comes every month. And at this time, please remember, when a girl becomes adult, when she has the first menstrual cycle or menses, this age we call it menarche. So the girl at adulthood, the age to start first cycle, menstrual cycle, we call it menarche. Now this cycle, for example, it starts at the age of 11 or 10 and a half. It will go for whole life up to 48, 50 years. So then these menstrual cycles will stop. So this age when menstrual cycle stop, we call it menopause. Menopause. So this is the stoppage of menstrual cycle. So we have two landmarks age in females. Number one, when the menstrual cycle start, we will call it menarche. Then it will stop at the age of 50, 48, 45 to 55. Some people may be late, 52, 48, any age. When menstrual cycle stops, we call it menopause. Pause is to stop. So we have back over here, ovary, over 4. This is the for meno. Pre-menstrual, for example, the term pre, before. Similarly, we can post-menstrual, after the periods. Then we have got ovo for ovocyte, ova, ovulation, the process of ovum coming out from the ovary. Ovaries, the place from where we get the ova. Then ovo4 also for ovary, ovophotomy. Only cut, not to remove, not ectomy. It is ovotomy, to make a cut in the ovary.
Incision.
Incision in the ovary. So this is for the roots. Then if we go further, these terms are all used for female system. Then we have got roots for oviduct. Oviduct is again fallopian tube. And we have seen that we have used the term salpingio for this fallopian tube or uterine tube. Utero for uterus, metro for uterus again, or metric. Hystero also for uterus. So look at this. These at least 3 terms we are using for uterus. Then cervico for the cervical part of the uterus, cervix. The meaning for this cervix is neck. Then vagino, then calpo is also for vagina. Then for female accessory organs, we have got vulva, epidio also for vulva, perineo, perineum, clitoris, memo for breast, mesto for breast. Then for pregnancy and birth, we have actually in embryo is janan. Yani in everybody, when we have got 2 cells, one from father and mother, sex cells, they fertilize each other and make a new cell, zygote. So this zygote will develop into an embryo first. Then it will develop into fetus. So up to 2 months, we call this 8 weeks, we call it embryo. Then after 8 months, 9 weeks to 9 months, Gablal Vilada, before birth, we call it fetus. Then child is born, and the newborn child is called neonate. Neo means new. Nate is birth. So neonate is newborn. Then it will go into child, and then it will go into adult, and then young, and then old, and like this. This is the life cycle. So over here we use the term embryo, fetus also for fetus. Now the process of giving birth to a child is called labor in common. Even in terminology we use that labor, delivery. In other words, we also call it delivery. So labor or delivery. This is the birth, child birth. Birth, also we use the word nate. And we have used this term, already we have understood prenatal, before birth, and postnatal, after birth. So lacto is about milk. So lactation is normal milk production. Galacto also for milk. Gravida for pregnant lady, we use word gravida. So when a lady becomes pregnant, fil hamal, We also call it conception. C-O-N in common English. Conception. So conception is pregnancy. T-I-O-N. Conception. So this is pregnancy. So we use a verb for this, conceive. Conceive means to become pregnant. So a lady has conceived, means she has become pregnant. So this is a word. Another word over here is gravida. So we will use word gravida. Gravida means to become pregnant. So we will, sometimes we write like this, G. If we write gravida, for example, G1. G1 means first pregnancy. If we write G4, means fourth pregnancy. So gravida is for pregnancy. Para for parent. Comes from parent. So when the lady has given birth to the child, we write para. Para P1. Or if two children, para 2. So now look at this. Sometimes you will see in the history in a file of patient like G2 para 1. So lady has become pregnant 2 times, but given birth only to 1 child. So 1 child is not born, it was missed. So this is the story, GP1, GP. We write it like this. You will see it again. So these are the terms for parity from parenthood. How many times she has given birth to the child? How many times she has become pregnant is gravida. Did you understand this, please? So these terms we will again use again and again. So let us see further. So this was all the previous slides, they were normal terminologies. Now, now we come to changes to disease. Pathology, we have agreed and introduced that it is about the diseases, disease process. So we will see this one. First term, amenorrhea. A mean absence. So no menorrhea, no menstrual cycle. So absence of menstrual cycle. So when no menses, then we call it amenorrhea. No cycle, no menstrual cycle. But if it is painful, then we call it dysmenorrhea. Dysmenorrhea. We use other terms also. We will see them. For example, we use a term oligomenorrhea. Oligo. We have used the term in urinary system. Anybody remember what this term oligouria means? Scanty urine, less urine. So less blood in the menstrual. Ectopic pregnancy, we have seen that when the ovum zygote does not go to the proper site where it has to implant. Endometriosis, this is from inside lining endometrium of the uterus. If this tissue is not in its, now normally we have seen that in the uterus, this is uterus. So inside the uterus, we have got this lining of endometrium. This is the normal right place. But if this tissue, it is on any other site, for example, we have got tubes over here, fallopian tube, so endometrium is here. So this is not the proper location. So this condition is called endometriosis. Then we have got fibroid. These are in the uterus. Actually, uterus is a muscular organ, very strong muscles, because this is a small size organ, but during birth, when the child develops there, it has increased huge size. So all this increase and enlargement is the muscular hypertrophy. They become more and more in size and volume. So sometimes these muscles, they develop masses, tumors. If they are benign, then we are call them as fibroid. They can be cancerous also. Now, one term menorrhagia, this is equivalent. Amenorrhea is absence and menorrhagia is very heavy discharge, and very less discharge is oligomenorrhea. So if menstrual cycle, menstrual blood is normal, this is menses. But if it becomes very excessive, menorrhagia. If becomes less, oligomenorrhea. If becomes painful, dysmenorrhea. If stops, amenorrhea. Then we have got pelvic inflammatory disease. In pelvis, we have seen the organs like urinary bladder partially. Then we have got the uterus. Then if they become swollen up, we have problems, what we call the pelvic diseases. So pelvic inflammatory diseases, because with the pelvic organs. So these terms are for diseases. Then we can get some laboratory tests for this also. For example, we have got first word amniocentesis. Though when we have talked that we are developing in mother's uterus. This is the uterus, and we get two cells, half from father and half from mother. This is vagina. So from here, this is the tube. So here we have got the ovaries. So from here, one ova has come out. It will reach here. One sperm will come, zygote will form, and we will go to develop here. From one cell, we will develop into million cells. So we are developing, we need food or oxygen, and we get it from mother through the blood supply, from the mother through an organ which we call placenta. So this, at this stage, if the child is developing, it is better if we see this picture, which we saw it in the very beginning, in the previous slides. So over here we have got, when you previous slide, this picture, look at this. This is the fetus, child, future child. This is the vessels which we are attached with the mother through the organ, red color, placenta over here. This is the wall of the uterus, mother's uterus. Then here we have got a liquid all around. We are floating in a liquid. We are swimming in a liquid. This is what we call amnion, amniotic fluid. So sometimes we want to take this out. This process of taking out the liquid is amniocentesis. We can analyze it. We can check it under microscope. Is there any problem? Any problem in the liquid can indicate some diseases. Aspiration, to take a fluid from the body. Colposcopy, we have seen this colposcopy. Colpo is for vagina. So visual examination of vagina and cervix. Conization, we remove a cone shaped part of biopsy. Whenever we have got, this is the uterus. So this is the cervix over here, this portion. So if we take a piece of this for testing, like a cone, like this piece to test it, this is called conization. Then we have got hysterosalpingiography. So we have tubes here, fallopian tubes on both the sides, and uterus, and here we have got the vagina. So if we put some colored material, some chemical which we call dye, as we color our hairs with the dyes. So color material, if you can put, and then we take a picture. So this colored material, for example, if it is red, then this, where is the color pencils? So when we take this colored material, and it will make a picture of our this whole part of the body of female system. This we call hysterosalpingiography. Look at the words, please. Hystero from uterus, then salpingio, we have just now finished, salpingitis, tubes, then take a picture X-ray, uterus and fallopian tube. This is called hysterosalpingiography or hysterosalpingiogram. Then mammography from mama, from breast, X-ray of the breast. Then pap smear. Now this portion of the uterus we have seen cervix. So cervical cancer is also common. Actually, this is only cancer which can caused by a virus, So this cancer is also we want to check in ladies before they get the cancer. So we, through this vagina, we take a small part of it, very scratching of it, and we test under microscope. This is called pap smear. So for all adult ladies, girls, it is advised that once in a year they should have pap smear because of the danger of cancer of the cervix. Pelvic ultrasonography, by ultrasound we can check all these organs. We can put ultrasound through the vagina, transvaginal, or we can check from abdomen, transabdominal. Then in pregnancy we can test them that whether there is pregnancy or not. This is called pregnancy test. So these terms for the different diseases. Then we go further. Now, treatment procedures, cauterization. Whenever cauterization is a common word, when we have got, for example, let us say see again, this is our part of the uterus and this is cervix. So if we take, for example, a part to test biopsy, or we are doing some surgery, so there will be, for example, bleeding here. So we want to stop this bleeding, so put a heat on this, electric heat. This is called cauterization. So we can stop the, and even if some tissues is there, for example, small growth, we can destroy it with the heat. So this is called cauterization. This is by heat. If we put cold, then we call cryosurgery. Now this portion, sometimes we want to, for example, something over here, for example, child, and this fetus has become dead. So we want to take it, remove it. So for this we perform this operation, D&C. Dilatation and curating means that we will dilate the cervical opening and we will cure it. Cure it means to scratch inside. Hysterectomy, removal of the uterus. Myomectomy, removal of the muscle. Tubal ligation. Now, very interesting. This we have seen ovary here. So one ovum is over here. It will go over here for fertilization. If we cut this tube or ligate this tube, what will happen? Ovum will not reach here. So no pregnancy can take place. So this is the process of what we call contraception. Contraceptions means when we do not want to create children, to produce children. Mane hamal. So we have some medicines, but this is surgery. Tubal ligation. We close the tube so that ovum does not reach to the site. So this is for a method when we stop the ovum to reach. Some abbreviations, they are not very important, but D&C we have done, gynae we have done, IVF, in vitro fertilization. This is the laboratory to produce a test tube baby. We have said that what is the basis for test tube babies? We have ovum from mother and sperm from father. But for example, mother is unable, some problem with the uterus, for example, some problem with the tubes, fallopian tube. So we take this ovum out in laboratory and we put a sperm over here, sperm of the father. So fertilization takes place outside the body. So this is called in vitro fertilization, IVF. Then this can be put into the uterus and child can. Another term we use for obstetrics, one word, one knowledge we have used, gynecology. This is the subject of the diseases of female system. Then the obstetrics, this is for the labor and delivery of the fetus. Pelvic inflammation, PID, sexually transmitted disease, sexually by those diseases which are caused by sex. THBS, so total abdominal hysterectomy, this is name of surgery. But these are terms which are commonly used, but not all to remember. So what is this message? Please don't interrupt in between. So this is for the next, I think this will be the last slide perhaps. So this is for your practice to label the terms and see these all. Now we will put today for the this on the e-learning. So in between, any question? We will